whatever it takes, we're going to do. And we'll find a way to get it done because we need to get her healed.
This is Maggie, an 11-year-old dachshund with a gaping wound in her back paw. The reoccurring infection has pushed her owners to use some of man's medicine for man's best friend. This is a hyperbaric chamber. For decades, doctors have used hyperbaric chambers to treat people with traumatic injuries. Now vets in a handful of states are using them on ailing pets.
Predominantly what we're using the chamber for is skin wounds or severe tissue trauma. That's what's been reported to be helpful in human medicine. And then we're also starting to look at using it in neurologic injuries.
Advocates say the chamber's high-pressure atmosphere of pure oxygen appears to help reduce swelling and aid healing time. However, some traditional medical experts say using a hyperbaric chamber on animals should be a last resort.
Have to be a therapy used when there is no alternative, or therapy used for a very serious problem for which there hasn't been a solution, and for which hyperbaric oxygen therapy is an efficacious or cost-effective solution.
There is little research on hyperbaric treatments in pets, although advocates note most of the research for human hyperbaric treatments comes from trials done on rabbits and rats.
But we have had cases in which we think they're leaving the hospital several days earlier because of a favorable response, and in that case they would actually potentially save money over the course of the hospitalization.
At the University of Florida, a pet session in a hyperbaric chamber costs about $150. The school may soon be able to quiet doubters. Researchers there will begin clinical trials this summer to determine the effectiveness of the treatment. Nia Hawkins, Associated Press.